Hello everyone, welcome to MedTeach. Today we are going to discuss about respiratory burst. Respiratory burst is also known as oxidative burst, which is a rapid increase in oxygen consumption by immune cells, such as neutrophils and monocytes, in response to the presence of the pathogens. This process involves the activation of the NADPH oxidase complex, which produces a surge of reactive oxygen species to help eliminate the invading microorganisms. Who are all the key players in this process? There are three important key players, namely NADPH oxidase complex, superoxide dismutase, and then myeloperoxidase. Let us discuss about the role of each of these key players. NADPH oxidase complex is responsible for catalyzing the production of superoxide ion from oxygen. The NADPH oxidase complex is composed of several subunits and is activated in response to the presence of pathogens. The next one is the superoxide dismutase. This enzyme catalyzes the conversion of superoxide ions into hydrogen peroxide. Superoxide dismutase plays a crucial role in regulating the levels of reactive oxygen species produced during the respiratory burst. And then finally we have the myeloperoxidase. This enzyme is found in neutrophils and converts hydrogen peroxide into hypochlorite ions, a potent antimicrobial agent. So we have seen three reactive oxygen species produced during this process. What are they? Superoxide ions, hydrogen peroxide, and then the hypochlorite ions. Superoxide ion is a highly reactive molecule that can damage cellular components. And hydrogen peroxide is also a similar kind which can damage cellular components. Hypochlorite ion is a potent antimicrobial agent that can kill the pathogens. What are the consequences of NADPH oxidase deficiency? This condition will result in a genetic disorder which is characterized by increased susceptibility to infections and impaired reactive oxygen species production. The disease is nothing but the chronic granulomatous disease. So this is a rare inherited disorder where the patient will be having recurrent severe infections with granuloma formation. So the clinical features will include bacterial and fungal infections, particularly with catalase positive organisms like Staphylococcus aureus, Aspergillus and all. And there is also granuloma formation in various organs including lungs, liver and lymph node. And finally, there can be inflammatory complications as well, which will include conditions like osteomyelitis, pneumonia, and gastrointestinal complications. We can diagnose this condition by using various tests, including dihydrorhodamine flow cytometry, which measures the reactive oxygen species production in the phagocytes. Then the nitroblue tetrazolium test or the NBT test, which measures reactive oxygen species production in phagocytes again. Then finally, we can also go for some genetic testing because chronic granulomatous disease is caused by mutations in one of the four genes that encode the subunits of the NADPH oxidase complex also. So these genes will include CYBA, CYBB, NCF1 or NCF2 genes. How will we treat this condition? We have to give the patient prophylactic antibiotics to prevent infections. Interferon gamma can be given, which enhances phagocytic function. Curative treatment for chronic granulomatous disease is, however, bone marrow transplantation, whereas gene therapy is still in the experimental treatment for chronic granulomatous disease. The prognosis for chronic granulomatous disease patients has improved significantly with the advances in treatment. However, chronic granulomatous disease remains a chronic condition requiring lifelong management and monitoring. Some of the additional facts related to respiratory burst. Pyocyanin, which is produced by Pseudomonas aeruginosa, is a pigment that generates reactive oxygen species to kill competing pathogens. And the respiratory burst leads to release of lysosomal enzymes also, which can help to eliminate the pathogens. This is all about respiratory burst and chronic granulomatous disease. I hope you liked this video. If you liked our video, please like, subscribe for more such videos. Thank you.